Good morning.
Good morning.
Okay, why are we little on the side? There we go. There we go. I'm like, what's happening over there? You know how they say we outside, we at work, we at work. I'm at work.
Mm.
I'm at work. How are you?
All right, and yourself?
I'm good. I'm a little sad. One, I missed the in the crib correspondent.
Oh,
It was such a short visit, but she's grown so much and she's doing so many things and she got a tooth and almost a tooth and a half in her little
okay.
bottom gum. So it's cute. And she crawling.
Uh-oh.
I know. She moving out the way, out the way. And then the other sad moment is we had the Jeezy experience here and I didn't get to go and I wanted to go, but I couldn't imagine. I heard about it late. Let me just say that. Had I not heard about it late, I probably would have got my tickets earlier. But I heard about it late, and the ticket prices at that point was probably in the price point of $500. I wasn't doing that. But it looked beautiful, and I love experiences, so I'm sad I missed it. But it looked like it was a fun time had by all. I probably
Okay.
just sang one or two Jeezy songs. I just wanted the experience. I think I went to a concert years ago where he was there. He did actually a really, really good time. But this was everybody was dressed up. It was like a black tie, and he had an orchestra and all of the things. So it looked really pretty. I like that.
Okay.
Yeah. How you doing?
I'm doing fine.
Yes, yes. All of the things happening, like all of the things are supposed to be happening.
Yes, yes.
Okay. Uh-oh. I heard a little something, something that yes. That just leads me to believe that there will be a lot happening at the meeting after the meeting. All right, all right. Well, let's see who got in the place. Look at everybody. Look, y'all missed us too. Look, y'all popping in. They popping in early. Good morning, Tanisha. Good morning. The revenue cycle ready with the crafty coder. That's a long name. Our on the street correspondent, the crafty coder.
Hmm.
Oh, thank you, thank you. Um, hey Tanika. I'm back. Okay, okay, okay. Okay, okay. All right. What you know about Jeezy? Let me find it. Girl, wait a minute now. You know I'm about it a little bit. I play a professional on TV for you every when I come on. But I got a little about it in me. Ask my husband. Anyway. Good morning, Dr. Jasmine. Good morning. All right, all right. Oh goodness. Oh wait, did I not send this one? I guess I didn't. I did not. Let me send this one. It's sitting in the you know how you had a conversation with somebody on text and you thought you sent the last text and then you go back and 2 days later the text that you thought you sent is still sitting in the box. It just
Hmm.
drives me crazy. I be like, can something ping to tell me, ma'am, look at the text. You still got stuff here. Yeah. All right, all right.
Look, that would be nice because those when you're online, those shopping carts do send you a reminder. Oh, did you
They
forget to
do. Why
check
can't
out?
some you know what I'm saying? They not only will they remind you, they'll send you an email saying, "Hey, did you forget something?" I've received those. Or I guess if you connect with them via text, they'll send you a text too. Did you forget something? Oh, we waiting. Well, I'm waiting too. Cool.
Can we stop the presses and read that note from Dr. Jasmine?
Wait a minute. Wait a minute. Oh, wait. I got something. Hold up. Let me see. You know, they did all kinds of little foolishness over here today. My God, today. Hold on. Guess who started a CBC class on Thursday? Who would that be? Wait a minute. Let me go to the thing that I found. I hope this works. All right, all right.
Congratulations.
Congratulations. You brushing up on those skills again, huh? Uh-huh. Gonna take the world by storm. All right, all right. I love it. I love it. Okay. Well, welcome everybody to our Saturday morning tea. Here we brew up the hottest topics in healthcare. We discuss health information, news, education, uh, getting into CPC classes, Jeezy, hey, experiences, connecting, reconnecting, all of the things. Plus, certification tips and entrepreneurship, the revenue cycle at large. As you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner, the girl with the pearls, the founder and senior education director at the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance in education. And let me ask, do you know what it takes to be a certified marketable medical coder? Do you? Well, before I introduce my co-host, let me share with you information on a free, yes, free 99 email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey. So if you're interested in getting more information about the 5 steps to become a certified marketable medical coder, check the video description for the link. There are a lot of links down there. Check them out. All right. Joining me today is my partner in success, my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for a very long time as a nurse first, and I left the bedside in 2014. And during the pandemic in 2020, I created a company called the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background who want to leave the bedside to transition into the wonderful world of HIM.
Mm-hmm. And how's that working for you, sir?
It's coming along.
Mm-hmm. Yes. Folks just don't know what they don't know, right?
No, sadly, they really don't. And it's a lot that don't know.
It's a lot that don't. I'm learning that every day. Ooh. Oh, okay. But before we jump in, let me remind you that you can join in and add to the conversation. As you see, the comments have been buzzing. So don't be shy. Your opinion matters and is welcomed here. So friends, use the chat. Use the chat. If you have a question, please type Q first so that we know it's for us and we don't miss it. So for those who are just joining us or watching the replay, today we are talking and asking, telehealth forever? A new bill could change everything. But first, let's get into some church announcements, shall we? See, they done moved all my stuff around. Hey. Mm. Yes. I feel like I need my church shouting shoes on. Yes. You know, you can't shout just right unless you got your heels on. You know what I'm saying? It's a little something. Shiny shoes, them hard bottoms, something gotta be just right. Hey. All right, all right, all right. Let's see. So, okay. So, I don't know if we talked about this before. I couldn't recall. But Mr. Jesse sent me some information about wait a minute, let me pull it up. You sent me some information about this takedown or crackdown or whatever the Department of Justice did a couple weeks ago. And in my research, and as I was looking for something to talk about, it was all over the place. I went into the actual report and the summary from the Department of Justice. And when I tell you, they talked about everything and everybody and who all and what all. And while there were a lot of cases that involved DME and genetic testing and drugs, another nurse school licenses was thrown in there. Several PPE payments that were fraudulent were in there. Folks from international waters were in there. It was a lot. I was like, this is a whole doozy. Like, is this all the work y'all did all year? Because this was a lot. And then, they broke it down all across the country. There was money laundering, stuff dealing with psychotherapy. That's all in my lane over here. Psychotherapy and all kinds of stuff. I'm like, what in the whole world is happening today? But I guess, they've been setting up stings. I mean, and not just the major players, Florida, California, New York, little North Dakota, Iowa, just little bitty places. One up the street in Dayton, Ohio. I mean, just everywhere. I was sitting here just tickled, if you will, about all of this stuff that has been happening. People done gone crazy, right? Playing with the church's money.
And then have the nerve to get upset when they hear about all of these crackdowns and how things are going to be automatically downgraded if documentation is not submitted. Then you wonder why.
And you wonder why. And I don't blame them not one bit. I do not. Like, we got proof that all of this stuff is happening and going on. We charging left and right and left, getting restitution and folks paying the money and doing all of the things. Why we got to chase y'all? Just make sure it's right on the front end. So the onus is now on you to make sure it's right on the front end. So send the documentation, send the stuff. Now, yeah, it may cause a little kink in you getting your money in the time frame you are accustomed to getting. But when you want to make sure you get money that you're going to keep versus money that you may have to send back and then some. I don't know. Call me crazy. But that was if you get an opportunity, I think I'll put the link somewhere. Patreon, I'll put it somewhere. My eyebrows was like, wow. It was crazy. Cray.
It's rampant. It's really
rampant. And it's just all kinds of stuff. So if you be like, what? The schemes that people come up with. It's amazing.
Now, I don't know if it's more of an uptick or whether it's just being reported more, but what I'm finding and shout out to Becker's, because I tell you,
I
They're
love
on the
them.
street.
I love
Their
them
on the street correspondents really be on the street
on the
corresponding.
street.
But I'm really starting to notice that there's a lot of nurse practitioners are starting to get caught up.
Yes, there were several
And I'm
nurse
like,
practitioners,
hmm.
but I think it to me it's the same thing that I'm running into um in the behavioral health space. There's just lack of information and education. Um, but then not only is there a lack of information and education, but folks are just like, well, I know what to do, or I can do this, and just jumping in 2 feet in without having a firm foundation or knowing how deep that water is. um, and making sure they have the boats and the life jackets and all of the things in the event. They just jump in 2 feet in. Oh, well, so and so said we could do so and this and that and a third. So let's just get it and do it. Really? Okay.
What I have what I have noticed, and this is just my unscientific opinion, but on the inpatient side with like CDI and not so much DRG because they know
Mhm.
that you got to know coding, but for CDI and other departments in on the inpatient side, they have no respect for coding and minimize it. But on the outpatient side, people have a total disregard for billing and billers and the importance.
I
And
feel
this
like
is
they have a whole disregard for compliance, period. The whole revenue cycle and compliance alike. It's like, what's that about? We don't need that. Just keep turning it out. Keep doing what we do. It's crazy. Crazy. Crazy work. So that was my announcement. Mr. Jesse, you have an announcement?
no.
No?
That
No?
no.
Okay. Good morning. Oh, I didn't even show the people. Look, I was just talking to the people. I told you I'm back at work. Y'all know what happens when y'all come back from work and y'all ain't been here in a while. Okay, good morning, Tanisha. We already said good morning. Hello, hello. Thank you. Hey, hey. All right, all right. Let's see. This is what she said. Good morning, Dr. Jasmine. You said hello, hello. Y'all funny. We talking about having things in
The
the same.
text.
Yeah. Welcome to Profi. Okay, look at y'all starting stuff. I'm gonna be starting something. You got to be starting something. Hey, love it, love it. And good morning. Oh, we love that you love the Saturday morning tea. Welcome, welcome. Right, absolutely. That's when it is. Then something happened and everybody looking with the big eye and scrambling. Kills me. Okay. Alrighty, alrighty. Well, let's get this party started. Get rid of the banner. Doop. Okay. I think we're ready. We ready. Well, let the tea spilling begin. So again, welcome or welcome back to the Saturday morning tea where we serve up the real talk our profession needs. Yes, I'm Clarice Warner, the girl with the pearls, with my partner in success, the coding nurse. And I hope you got your favorite tea brewing because we're about to have a little shift in the conversation, just a little bit. So today's topic, telehealth forever? The new bill could change everything. Everything, everything. But before we dive into today's shift in conversation, let me make sure I got a fresh cup of tea. And I do. I have me some chamomile, blueberry, vanilla.
Uh-oh.
Yes. With, I always got to have ginger and turmeric as well. So with some ginger and turmeric in there. And something about that is a little sweet. So that is actually the sweetness. I don't even add any additional sweetness to it. But anyway, because honey, we're about to discuss something that's going to require all the calm energy we can muster. Today, we're talking about healthcare access, specifically telehealth. and how one piece of legislation could change everything for millions of Americans. Now, I know healthcare policy might not be everybody's idea of Saturday morning conversation, but stick with me for a minute. Stick with us for a minute. Mr. Jesse, jump in as you see fit. By the end of our time together, you'll understand not just why this matters to you, your family, and your community, but also the complex web of interconnected issues that make this legislation both crucial and challenging. Because here's the thing, accessing quality healthcare shouldn't be complicated. It could all be so simple. And today, we're going to talk about legislation that might actually make it that way, while also exploring why it's taken so long to get here. So let me start with a story that might sound familiar. Picture this, it's 2019, and little Miss Sarah, a single mother in rural Montana, needs to take her son to see a specialist for his ADHD. The nearest pediatric psychiatrist, 3 hours away. That means a 6 hour round trip drive, gas money that she doesn't have, missing work that she can't afford to do, and arranging childcare for her other children. But here's what makes Sarah's story even more complicated. Even if she could somehow make that trip work financially, she'd have to do it again and again, follow up appointments, medication adjustments, therapy sessions. And each visit is another day of lost wages, another tank of gas, another stress on an already stretched family budget. Now, fast forward to March 2020. The world changes overnight. Suddenly, Sarah can have that appointment from her kitchen table while her son sits comfortably in his own home. The doctor can see how he interacts in his natural environment, observe his actual living conditions, and provide care that's not just accessible, but potentially more effective. No travel, no missed work, no additional stress. This transformation happened because of emergency flexibilities put in place during the COVID-19 pandemic. The government essentially said, you know what? Let's remove all these bureaucratic barriers and see what happens. It was a crapshoot. Shake them up, shake them up, shake them up, shake them. And what happened was remarkable. According to the documents I've been reviewing, and I'll be referencing, there was a letter from the American Medical Association through, and we'll talk about that throughout this conversation today. Hundreds of thousands of Medicare patients in rural areas could finally access virtual care without costly travel. But here's where our story takes a concerning turn. These flexibility, they're temporary. They've always been set to be temporary. They were extended through March 2025, but as I'm recording this, they're set to expire September 30th, 2025. And unlike previous deadlines that got extended at the last minute, healthcare providers and policy experts are experiencing what they're calling, quote, policy cliff fatigue, end quote. It's a dangerous complacency because people assume Congress will just extend these provisions again. This brings us to today's main topic, the Creating Opportunities Now for Necessary and Effective Care Technologies for Health Act of 2025. Yes, that is quite a mouthful. So let's just call it the Connect Act, or HR 4206. This bill was introduced by a bipartisan group, and let me emphasize that word, bipartisan. Representatives Mike Thompson from California, David Schweikert from Arizona, Doris Matsui, I know I probably butchered that, from California, and Troy Balderson from Ohio. When Democrats and Republicans agree on something in today's political climate, it's probably important. The Senate companion bill already has 63 co-sponsors, which is a remarkable momentum for really any kind of legislation, but specifically healthcare legislation. So, what exactly would this bill do? Let me break it down into digestible pieces. First, it would permanently eliminate geographic restrictions for Medicare telehealth services. Right now, there are antiquated rules about where you can receive telehealth. You might have to be in a rural area or at a specific type of facility. The Connect Act says if you have internet access, you can access telehealth, period. It could all be so simple. And this bill recognizes that. Second, it removes the requirement that patients travel to, quote, originating sites, specific facilities to receive virtual care. Under current permanent law, you may have to drive to a clinic just to have a video call with a doctor somewhere else. Now, that in and of itself sounds crazy to me. So how ridiculous is that in 2025? Third, it eliminates the 6-month in-person visit requirement for telemental health services. And this is huge, especially for behavioral health access. The bill recognizes that mental health care shouldn't have arbitrary bureaucratic barriers. Fourth, it expands which types of healthcare practitioners can provide telehealth services and allows federally qualified health centers and rural health clinics to serve as distant site providers permanently. Now, let me share some data that really drives home why this matters. Stanford Health, a health system based in South Dakota serving largely rural patients, reports that telehealth saves their patients an average of 176 miles per round trip. That's 176 miles. They serve more than 2 million patients across 250,000 square miles. That's larger than many entire states. Two-thirds of their telehealth patients live at least 30 miles from a major medical center. In the last decade alone, they've delivered nearly 1 million virtual consultations, saving patients 51.2 million travel miles. Think about that for a moment. 51.2 million miles of travel saved. That's not just convenience, that's money saved again on gas, time saved from work, reduced wear and tear on vehicles, less childcare needed, and most importantly, reduced stress on families already dealing with health concerns. Now, let's talk about who this really affects because the impact goes far beyond rural communities, though they will certainly benefit tremendously. The American Medical Association, in their letter supporting this legislation, points out that telehealth access has lowered barriers for many patient populations. We're talking about individuals with functional limitations that make travel difficult, people experiencing unstable housing, those without reliable transportation or childcare, and patients in areas with healthcare workforce shortages. Let me paint you another picture. Imagine you're caring for an elderly parent with dementia. I swear this is knocking on my door. Getting them to appointments is increasingly challenging. They're confused by new environments, agitated by travel, and we only go a few miles. And you're stressed trying to manage their care while maintaining your own work and family responsibilities. I swear, did they put me in this? With permanent telehealth access, many of those routine check ins, medication adjustments, and care coordination meetings could happen from the comfort of the familiar environment. It could all be so simple, and it should be. The data supports this transformation. Since the pandemic began, physician adoption of telehealth has increased threefold. 74% of physicians now work in practices that offer telehealth services. And this isn't a fad or a temporary solution. It's become an integrated part of how healthcare is delivered. And here's something particularly close to my heart: the impact from behavioral health. The AMA notes that 1 in 5 behavioral health appointments at Sanford Health is now virtual. Mental health services have historically been even more difficult to access than general medical care, particularly in rural and underserved areas. So the Connect Act would ensure that people seeking mental health support don't face additional barriers. No more requirements for in-person visits within 6 months of starting mental health care. Because when somebody is ready to seek help for their mental health, we should make it harder than it already is. But here's what's particularly exciting about this legislation. It's not just removing barriers, it's enabling innovation. The AMA letter specifically mentions that the expansion of telehealth has led to innovative hybrid models of care delivery. We're seeing combinations of in-person visits, telehealth consultations, and remote monitoring that give patients the optimal mix of care modalities. All right. Yeah. Mr. Jesse, you want to add in? Man.
I don't see, since it has overwhelming support, I can't really see it being a problem, but I can see it being a problem.
It's got well. So the thing you got to know about, and I'm gonna get to that about these bills. Oftentimes, it's not just about one particular topic. It's all kinds of stuff thrown in the mix, and so for people to say yes, I support this, but I'm side eyeing that is where the problem usually happens. Because yes, I'm a rah rah, and I'm like, this is great, but that stuff right there, y'all playing. Stop trying to tack this in and tack that in and tack that in, and that's where the usually the battle comes into play. Um, let's see. I'm trying to read y'all stuff. You learn something new every day with Coney. You absolutely do. A podiatrist wanted to do telehealth. Make it make sense. Well, maybe I don't know. I was gonna try it, but no, I'm gonna fall back. Be like, put that camera and show me your feet. Because at some point you still gonna have to come in, especially if there's something, yeah. Telemedicine has been an important part of providing care to individuals in those rural areas. I remember doing a study about chronic disease management in the Mississippi Delta many years ago. Telemedicine has been integral in managing conditions in that population. Absolutely, absolutely, absolutely. And I know for me, I saw my hematologist, oncologist in person when needed, but unless I have a flare, telemedicine works. My recent flare required in-person visits. Absolutely. I mean, the only problem that happened with us with our telemedicine visits, which really didn't have anything to do with it was the office's process. So once you come out of the telehealth well, once you go to in-person visits, you go, you check out. If you need to make your appointment, you can make your appointment right then and there, da 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 da. With telehealth visit at this particular location, once you got off the phone with the doctor, it was a wrap. And it was like nobody thought, oh, we need to go ahead and make the next visit, or don't forget to call back and make your visit, or something to that end where you complete the process. And that didn't happen. Um, and that it's been a couple years since we did one, and because we fell out the loop, like, I ain't seen so and so in a while. I got a lot going on. So unless my stuff on the calendar, and I just realized, like, I haven't seen, this particular physician in a while. And then it hit me, oh, we had a telehealth visit and we just shut it down. Like, all right, well, you take care. All right, bye. And we didn't make that follow-up appointment. So it's some process things that need to happen in these practices as well when they are using. And I'm sure by now most folks have and are doing that. Okay. All right. So before we dive deeper, I want to prepare you for what's coming next. I'm going to walk you through 7 interconnected policy areas that all affect telehealth access, from payment issues to prescription rules to licensing barriers. So think of it as untangling a complex knot. Each thread we pull affects all the others. So stay with me, because understanding these connections is crucial to understanding why comprehensive healthcare reform takes so long, and knowing how things work in Congress. You see, telehealth isn't just about one piece of legislation. No, it's like a spider web of interconnected policies. And when you pull one strand, it affects everything else. Again, let me walk you through these issues. First, let's talk about the money. You know, we always talk about the money. And in healthcare, it always comes back to the money. So while the Connect Act addresses Medicare coverage, we have a payment parity crisis happening right now. So as of April 2025, only 22 states require insurance companies to pay the same rate for telehealth as they do for in-person visits. 22 states. That means in 28 states, doctors might get paid less for providing the same care virtually. Even worse, CMS, and you know that's the Centers for Medicare and Medicaid Services, implemented new fee schedules on January 1st, 2025, removing temporary payment increases that were in place for 2024, resulting in roughly 2.83% lower payments for healthcare providers in 2025. So we're asking doctors to expand telehealth services while simultaneously cutting their reimbursement. All right. Does that make sense? Look, that's why they frustrated and mad. Second, we have what I call the prescription crisis. Right now, doctors can prescribe controlled substances. Think pain medication, ADHD medications, anxiety medications via telehealth, thanks to the emergency waivers. But those waivers, when they expire, and these expire, I think at the end of the year, the DEA has delayed implementing new rules that would severely restrict this ability, but the uncertainty is driving healthcare providers crazy. So imagine if you're managing chronic pain or ADHD through telehealth visits, and suddenly your doctor can't prescribe your medications without requiring you to come in person. For someone like our friend Sarah in rural Montana, that could mean her son loses access to his ADHD medication unless she can make that 6-hour round trip regularly. Third, there's the licensing nightmare. The Connect Act removes geographic restrictions, but doctors still need to be licensed in every state where they treat patients. We have interstate compacts for nurses, physical therapists, and other professionals. 40 states for nursing, 35 states, plus DC for physical therapy. But physicians, they still they're still stuck in a state by state licensing system that dates back to when people traveled by horse and buggy. So the Connect Act might say you can receive telehealth anywhere, but if your doctor isn't licensed in your state, you still can't get care. Again, it could all be so simple if we had a national licensing system for telehealth, but we don't. Fourth, let's talk about the digital divide. The legislation assumes everyone has reliable internet access, but that's simply not true either. Rural communities, the ones that would benefit most from telehealth, often have the worst internet infrastructure. We're talking about areas where a video call might freeze every few minutes, where upload speeds are too slow for quality virtual visits. And it's not just rural areas, low income urban communities, elderly patients who aren't comfortable with technology, people with disabilities who need assistive technologies, they all face barriers to accessing telehealth that this legislation doesn't directly address. Fifth, there are legitimate privacy and security concerns. The rapid expansion of telehealth has outpaced our privacy regulations. HIPAA, and we all know that stands for Health Insurance Portability and Accountability Act, was written long before anyone imagined routine video calls with doctors. We need updated, streamlined privacy policies specifically for telehealth. But again, that requires separate legislation. Six, we have what's called the FQHC and RHC problem. And those are federally qualified health centers and rural health clinics. And basically, the safety net providers that serve our most vulnerable populations. But right now, they can serve as telehealth providers through the end of this month, but they lose that authority if the Connect Act doesn't pass. These are the clinics serving people who are uninsured, underinsured, or on Medicaid. If they lose telehealth authority, the people who most need access to care will be the first to lose it. Seventh and finally, there's the quality and fraud issue. As telehealth has expanded, so has healthcare fraud. We just talked about all of the stuff that got in that in that crackdown. There's all kinds of stuff in there, including some telehealth issues. The Department of Justice has been cracking down on fraudulent telehealth companies, which is good, but it's also making legitimate providers nervous about compliance. We need clear guidelines about what constitutes appropriate telehealth care versus what crosses the line into fraud. And then there's the Medicaid maze. While the Connect Act focuses on Medicare, Medicaid policies vary dramatically by state. Some states have embraced telehealth expansion, others are still restrictive. Since Medicaid serves our most vulnerable populations, children, pregnant women, people with disabilities, low income families, these state by state variations create massive equity issues. Now, I know you might be thinking, Clarice, this all sounds incredibly complicated, and maybe telehealth expansion isn't worth all these headaches. But here's where I want you to understand. These complications exist because we're trying to fit 21st century healthcare technology into 20th century regulatory framework. The Connect Act isn't perfect, but it's a crucial step toward making the system work for patients instead of bureaucrats. Let me share a real example of how interconnected issue plays out. I read in one of the articles that a mental health counselor in Nevada who treats patients across rural the rural Southwest. So under current emergency flexibilities, she can see a patient in Arizona via telehealth, prescribe anxiety medication, and coordinate care with their primary doctor in California. But when the flexibilities expire, she loses the ability to prescribe across state lines. The patient in Arizona has to find a new provider if one exists within driving distance. The care coordination with the California doctor becomes much more complicated. And what was a seamless, effective treatment relationship becomes fragmented and potentially ineffective. Multiply that story by hundreds of thousands of patients, and you start to understand the stakes. So the Connect Act addresses the Medicare piece of this puzzle, which is huge because Medicare covers 65 million Americans. But we need complementary action on licensing, DEA prescribing rules, privacy regulations, infrastructure investment, and Medicaid policies. The good news, there's a growing bipartisan recognition that these issues are connected. The bad news, Congress tends to address them in silos, which creates gaps and contradictions, and the reason why things don't get passed or things do get passed. Here's what gives me hope. The healthcare industry, patient advocacy groups, and even many legislators understand that we can't go backwards. The pandemic proved that telehealth works. And when we remove artificial barriers. So patients expect it, doctors have invested in it, and healthcare systems have built their future plans around it. The question isn't whether we should expand telehealth permanently, it's whether we'll do it thoughtfully or chaotically. The legislation represents something bigger than just healthcare policy. It represents recognition that our systems should work for people, not the other way around. For too long, we've accepted that accessing healthcare should be complicated, time consuming, and expensive. We've normalized the idea that geography should determine your access to quality care. We've accepted that bureaucratic rules from decades ago should govern how we use modern technology. But the Connects Act says no more. It recognizes that technology can be a great equalizer, that virtual care can complement in person care beautifully, and that patients should have options that fit their lives and circumstances. But more than that, it opens the door to innovations that we're just beginning to imagine. remote patient monitoring, AI assisted diagnostics, virtual reality therapy, digital therapeutics. These aren't science fiction anymore. They're real tools that could revolutionize healthcare, but only if we have the regulatory framework to support them. Again, it could all be so simple. And with this legislation and coordinated action on the related issues, it would be simpler. The bill has strong bipartisan support, again, with the Senate companion bill having 63 co sponsors, the American Medical Association representing hundreds of thousands of physicians and medical students strongly supports it. Healthcare systems across the country are advocating for it. Rural health organization, patient advocacy groups, and even health insurance companies see the value. But do you? So here's where you can help our fellow healthcare advocates. Legislation doesn't pass on its own merit, no matter how sensible it is. It passes when people like you and me make our voices heard. So this is where you can put in your advocacy cape and join in the fight. So again, it passes with our voices. And with all the interconnected issues we've discussed, we need to even be more strategic about our advocacy. So, this is what I'm asking you to do. First, contact your representative about HR 4206. And if you have a telehealth story, tell them your story. Don't just talk about the Connect Act, mention the broader issues we discussed: DEA prescribing rules, interstate licensing, payment parity, and rural broadband access. Again, your personal experience with these barriers is more powerful than any policy argument. Stay engaged on multiple fronts. Again, this isn't just about one bill, it's about sustained advocacy on telehealth licensing, reimbursement policies, and infrastructure investment. So follow the organizations working on these issues and track what your state legislature is doing, and talk to your healthcare providers about their concerns and capabilities. Third, think beyond your own experience. If you have good internet, reliable transportation, and comprehensive insurance, advocate for those who don't. Support policies that work for rural patients, elderly individuals, working parents, and people with disabilities. Healthcare equity requires all of us to speak up for vulnerable populations. Okay. So you can always go out and do a Google search for your representatives and their contact information. And usually and if you do a Google search about this particular bill and those that are connected to it, oftentimes you'll find like template language or a full template where all you got to do is plug in your name, sign at the bottom, and send send your story. It's really usually that easy with these advocacy initiatives. And finally, please, please don't let this be something you just watch and forget. Our healthcare system only changes when we demand better. So when we refuse to accept that accessing care should be complicated, expensive, and stressful, the interconnected nature of these issues means that we need sustained, coordinated advocacy. It's not enough to pass the Connect Act if we don't also address the other pieces for the prescribing rules, licensing barriers, and payment equity. But it all starts with this foundation legislation. Okay. So as we close our time together this morning, oh, Mr. Jesse, did you have anything before I jump in with the closing?
Yeah,
My bad.
I just wanted to say
I ain't see your flags raising. No,
that
okay.
I just wanted to say that I think that this bill is important, and I'm sure with that kind of bipartisan support, is going to pass.
Mhm.
But also, um, this is a great opportunity for like Tanisha, you're studying for your CPB. For anybody that has anything to do with billing, and especially billing, when you start talking about crossing state lines, you also start talking about crossing into different MACs.
Mhm.
And there's going to be different billing requirements for different regions. And it's going to create a great educational opportunity and an entrepreneurial opportunity for a lot of people who want to get into billing and the revenue cycle. So I think that it's definitely something to watch because it's going to create a lot of opportunity on the back end because we know that these people don't document properly for the states that they cover, let alone dipping their toes across the state, across 3 or 4 states. So it's going to be an opportunity, I think.
Hmm. I agree. As we close our time together this morning, I want you to remember that healthcare access is about more than policy. It's about dignity, it's about families, it's about communities. It's about recognizing that in 2025, geography shouldn't determine your access to quality care. Every mile not traveled to reach care is a mile that family doesn't have to stress about. Every appointment conducted from home is an appointment that doesn't require taking time off work, arranging childcare, or spending money on gas. Y'all know how these gas prices be fluctuating. One day it's one price, the next day it's $1.50 more. What in the world? Every prescription that can be managed via telehealth is one less barrier between a patient and their health. So the Connect for Health Act represents progress, simplicity, and common sense. But it's also just the beginning of the work we need to do to make healthcare truly accessible and equitable. Again, it could all be so simple. And with your help, your advocacy, and your sustained engagement, it will be. Yay. So join our community at Professional Reimbursement Network LLC, where we provide ongoing education, compliance updates, and practical strategies for navigating this complex environment. You don't have to figure this one out alone. And with that, look at me, just transitioning. So thirsty for fresh perspectives on healthcare revenue cycle. By becoming one of the PRNT sippers, you can join a community of sharp minds who savor the complexities of the healthcare revenue cycle. Why sip alone when you can steep in knowledge together? Come, let's spill the tea on industry insights. Here's what you can expect as a valued member of the Tea Sippers. Exclusive healthcare insights, gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access, be the first to receive expert insights and guides, ensuring you stay ahead in the ever-evolving healthcare industry. Personalized support, enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. Oh, we got a lot of stuff going on too, so it's going to be hot today. Community connections. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. And that's my favorite part. So, by supporting us, you're not only advancing your healthcare knowledge and career, but also contributing to the success of the Professional Reimbursement Network, LLC, a resource that empowers healthcare professionals like you to thrive in their roles, goals, and dreams. So, thank you for considering becoming a member of the PRNT Sippers. For as little as $1 per month, you can join the community. Check out the link in the description of the video. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. For our Saturday morning tea family, thank you. Thank you for spending your Saturday morning with us. I know your time is precious, and we don't take it lightly when you choose to spend it here. You could be anywhere else in the world, but you're here with us at the Saturday morning tea. So, we're all about building a community of savvy, informed, marketable healthcare professionals. So, again, like, share, subscribe, and comment, and let's grow this community together. Mr. Jesse, do you have any closing thoughts?
No, this was a great topic because it's timely, it's important, and has a lot of implications.
And so, this is again getting you to think about some of the whys behind what it is that you do. So even if you're on the front line, if you're in the revenue cycle, if you're billing, if you're coding, if you're even at registration, you're on the back end, you're auditing, you're doing revenue integrity, all of those things. These become peeks into the whys of why it is you do what you do, how you do, and when and where you do it. Keep that in mind. All righty. So Also, keep in mind, it could all be so simple when you focus on what truly matters. Your voice matters, your advocacy matters, and together we can untangle this complex web and make healthcare work better for everyone. So tune in next week as we'll be discussing another hot healthcare informational topic that you won't want to miss. So see you PRNT sippers at 10:15 a.m. Eastern Daylight Time. I think I did that right. This is Clarice Warner, the girl with the pearls, reminding you that in healthcare, knowledge isn't just power, it's protection. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care. See you later. Have a good weekend.